So hello बच्चों and welcome back to the clinical anatomy case discussion of the lower limb part 3. ठीक है, I'm sure आपने पहले दो parts देख लिए हैं, part 1, part 2. We start with part 3. Have a look at this, understand the question. जब भी आप क्वेश्चन पढ़ोगे तो that time try to analyze the question, तभी एक diagnosis पे arrive करिए and then see the sub questions. Right? You should not see the sub questions first, huh? हाँ, चलो, starting this. A penetrating injury in the greater sciatic foramen region causes weakness of hip abduction and medial rotation. So penetrating injury in the greater sciatic foramen. आपको पता है बच्चा greater sciatic foramen होता है, lesser sciatic foramen होता है pelvis में. The greater sciatic notch and lesser sciatic notch actually होता है pelvis में. It is converted into a greater sciatic and a lesser sciatic foramen by the sacrotuberous and sacrospinous ligaments. The sacrotuberous and sacrospinous ligament converts the greater sciatic and the lesser sciatic notches into foramens. इसको foramen में convert करते हैं. So what are the structures passing through the greater sciatic foramen? Greater sciatic foramen से what are the structures which pass? We'll just greater sciatic foramen से structures passing. Anyone? चलो, we'll start. One is Piriformis. ये पूछता है एग्जाम्स में, so you have to know this. Piriformis. Second is superior gluteal nerve and vessels. I'm writing in shorter, superior gluteal nerves and vessels. Third is inferior gluteal nerve and vessels. Superior gluteal nerves and vessels क्या supply करते हैं? Gluteus medius, minimus and tensor fascia lata. Superior gluteal nerve supplies the gluteus medius, minimus and the tensor fascia lata. Tensor fascia lata. That's superior gluteal nerve. Inferior gluteal nerve supplies what? Gluteus maximus. ये gluteus maximus को supply करता है. Fine. The next nerve is sciatic nerve. Sciatic nerve. Next is posterior cutaneous nerve of thigh. Posterior cutaneous nerve thigh. ठीक है. नेक्स्ट आते हैं अपने तीन स्ट्रक्चर्स 6, 7, 8 विद द नेम ऑफ पिन. इनका निमोनिक है पिन. व्हाट इज पी? प्यूडेंटल नर्व, इंटरनल प्यूडेंटल वेसल्स एंड इज नर्व टू obturator internus. So these are the structures which pass through the greater sciatic foramen, which comes out through the greater sciatic foramen. Clear है? So the piriformis, the main muscle क्या होता है? Piriformis को क्या हम बोलते हैं? The key muscle of the gluteal region. Then comes the superior gluteal nerves and vessels, inferior gluteal nerves and vessels, the sciatic nerve, the posterior cutaneous nerve thigh, the pudendal nerve, internal pudendal vessels, nerve to obturator internus. एक और है. What is that? Nerve to quadratus femoris. चलो, I'll write one this. Nerve to quadratus femoris. So ये याद रखना बच्चों. This is asked in the MCQs. MCQs में पूछता है, Vivas में पूछता है, तो इसे याद रखना. अब all these structures come out through the greater sciatic foramen. ये greater sciatic foramen से बाहर निकलते हैं. And out of these three structures, and out of all these structures, तीन structures होते हैं which winds around the ischial spine and enters the lesser sciatic foramen. Three structures. Which are those three structures? ये जो तीन structures हमने लिखे हैं by the name of pin. ये है pin. ये तीन structures है ना, pudendal nerve, internal pudendal vessels and nerve to obturator internus. ये क्या करते हैं? They wind around the ischial spine and they enter the lesser sciatic foramen. याद रखना. The pudendal nerve, internal pudendal vessels and the nerve to obturator internus get out through the greater sciatic foramen, winds around the ischial spine and enters the lesser sciatic foramen. Clear है? ये याद रखना. So ये clear है? Structures emerging out through the greater sciatic foramen. This is very important. Fine. So injury कहाँ पे है? In the greater sciatic foramen. तो structures हमको पता है. Fine. Weakness of hip abduction and medial rotation. Any guesses? Who does abduction at the hip joint? The main abductor at the hip joint कौन है? Gluteus medius. Yes, ये हमने previous clinical case में भी discuss किया है. बच्चों, just see the cases in sequence. Sequence में देखना, randomly नहीं देखना. So when you see in sequence, आपका एक है ना, एक subject एक कंसेप्ट डेवलप होगा, कंसेप्ट विल बी डेवलप्ड, राइट? So weakness of hip abduction. Hip abduction, the main muscle is gluteus medius. Medial rotation, the main muscle is gluteus minimus. So gluteus medius gaya, gluteus minimus gaya. Nerve कौन है? Which is the nerve then? Yes, which is the nerve then? Yes, the superior gluteal nerve. Very good, the superior gluteal nerve. Fine. With preserved hip extension. Ab extension of the hip is done by whom? Extension of the hip is done by gluteus maximus. Yes, gluteus maximus is the chief extensor at the hip joint. That's a chief extensor at the hip joint. That's gluteus maximus. So hip extension is retained, preserved है. मतलब gluteus maximus is intact. मतलब inferior gluteal nerve is intact. I hope this is clear to all of you. बच्चों develop हो रहा है, concept develop हो रहा है. Are you able to follow this? Yes. So abduction and medial rotation is weakened. मतलब gluteus medius and minimus are involved. मतलब it is an injury to superior gluteal nerve. Hip extension is retained. मतलब gluteus maximus is intact. मतलब inferior gluteal nerve is intact. Right. So which nerve is most likely to be injured? Understood now how to approach a clinical case? Clear hai? So which is the nerve likely to be involved? That's an inferior gluteal nerve. Inferior gluteal nerve is involved. Through which compartment relative to piriformis does it exit? मतलब इनका कहने का मतलब क्या है? Look, अगर ये हमने gluteus maximus ड्रॉ किया, हाँ, we draw this as gluteus maximus. ये 4 quadrant बना है gluteus maximus. Injections कौन से quadrant में देते हैं? Yes, supralateral quadrant. Yes. Inframedial quadrant में there's a big nerve which comes down. What is this? Sciatic nerve. Sciatic nerve. What is this muscle? जो key muscle बोलते हैं हम इसको, key muscle of the gluteal region. That's a piriformis. That's a piriformis key muscle because जैसे आपको piriformis मिलेगा, you get everything in this region. Fine. So what is this nerve which goes above the piriformis? उसके artery के साथ. What is this? This is the superior gluteal nerve and vessels. Superior gluteal nerves and vessels. So where does the superior gluteal nerve emerge with respect to piriformis? On its upper border. Upper border. ये in the vivas also they ask piriformis दिखाता है, which is this nerve. So remember piriformis के ऊपर एक ही nerve होती है, that's a superior gluteal nerve and vessels. Rest everything is below the piriformis. Rest everything is below the piriformis. That's a inferior gluteal nerve and vessels. Inferior gluteal nerves and vessels. ये sciatic nerve आ गई. This is the posterior cutaneous nerve of thigh. Posterior cutaneous nerve of thigh. And then there are 3 structures. Pin. I'm just making this like this. Pin. ये 3 structures है. Pin. Pudendal nerve, internal pudendal vessels, nerve to obturate internus, and there's a nerve to quadratus femoris. So ये जितने भी structures हैं, they are related to which muscle? Piriformis. ये याद रखना, piriformis को related. Fine बच्चों, समझ में आ रही है? Are you able to understand the gluteal region? Very important. So through which compartment relative to piriformis does it exist? So क्या लिखोगे? At its upper border. At its upper border. Upper border of piriformis, it emerges out. Which muscles are denervated? कौन से muscles denervate हो गए? मतलब which muscles lose their nerve supply? That's the gluteus medius, gluteus minimus, and tensor fascia lata. Tensor fascia lata है ना? So inferior gluteal nerve supplies 3 muscles: medius, minimus, and tensor fascia lata. Which artery typically accompanies it? मतलब जो inferior gluteal nerve के साथ, which is the artery which comes? The inferior gluteal artery. Inferior gluteal artery is the branch of anterior division of internal iliac. Anterior division of internal iliac की branch है inferior gluteal artery, whereas superior gluteal artery is a branch of the posterior division of internal iliac. Posterior division की branch है superior gluteal artery, anterior division of internal iliac की branch है inferior gluteal artery. Perfect है बच्चों. So this gluteal region gives many MCQs. अलग-अलग type के MCQs होते हैं, अलग-अलग type के clinical cases होते हैं. So try to understand them and be very clear about this. I hope this clinical case is clear to all of you. This is very important. तो एक MCQ मैंने यहाँ पे भी लगाया आपके लिए बच्चों, specially for you. So एक बार ये clinical case clear है? this discussion is clear, you should be able to answer this MCQ. Structures emerging from the greater sciatic foramen includes all except. इसे comment box में जरूर answer करिए. I'll be the first one to see your comments. In case of doubts, do get back to me. In case of queries, please do write to me. Okay. Thank you so much from the entire team of Anatomy Unlimited. Anatomy Unlimited. Okay. Thank you so much. And this is my YouTube channel. That's my Instagram. That's my Telegram channel. And इंस्टा पे काफ़ी मैंने ना छोटे छोटे वाइवा टाइप ऑफ क्वेश्चंस लगाए हैं एंड स्मॉल स्मॉल टॉपिक्स हैव डिस्कस इन अ फन वे सो जस्ट सी देम योर वाइवा टॉपिक्स विल बी वेरी क्लियर थैंक यू सो मच वंस अगेन बाय बाय सी यू इन द नेक्स्ट क्लिनिकल केस डिस्कशन